going to go ahead and get started. This is the Senate Committee on Health. We're going to get started as a subcommittee. Once we get the proper number of individuals here, we will pause, establish a quorum, and then continue. Normally, we go in order. However, we have a special request to allow item number 2, SB 977 PAN, to go first. Now, keep in mind, we always usually have members who are on the committee go last. So even though Senator Pan shows that he's item number 1 and 2, but traditionally they would go last because they're in the committee. The reason why he put a request in, let me just make a couple announcements, and I'm going to talk a little bit about the request before we get started. We have 14 items on the agenda today. 3 of these items are proposed for consent. Item number 10, SB 1335 Mitchell. Item number 11, SB 1361 Nielsen. Item number 13, SB 1477, that's a Health Committee bill. We're asking that there be no video filming in the committee room unless you are with the media and you have credentials and you clear it with the sergeants. Okay, now going on to the item number 2, the reason why we're having a special request is this is Senator Pan's 8th grade class from St. Elizabeth Ann Seton School. Their teacher is Sue Earl Lynn, and I had the pleasure of speaking with the young individuals yesterday close to my office, and this is their bill idea that they've pitched to the senator. So the senator is going to be presenting a bill on their behalf. The other thing too is that the presenters of the bill are going to be the students themselves. So I'd like to take this opportunity to, number 1, commend them for bringing the bill forward, but more importantly, for engaging in the political process at such a young age and for coming up here and presenting their testimony on behalf of the Senate Health Committee. It is also my understanding that they came with their entire class, which is roughly around 30 students. Now, normally the way it works here is we always ask for support and opposition. When we ask for support, everybody and anybody can come up and give their support after the initial 3 minutes of support and 3 minutes of opposition, and you're supposed to state your name and position. But if you don't mind, when we ask for the support from the students, if we can just have you stand at the appropriate time, I will recognize you. Unless you absolutely feel that you want to come and speak in front of the microphone, then feel free to do so, but I'd appreciate if we can just recognize you because I know you're here in support of your colleagues and of the bill itself, okay? So again, let me reiterate, we will have 6 minutes on each side, and then after that, we just ask that you state your name and position. So we're gonna start off with item number 2, SB 977 PAN, Tobacco Use Sports Event. Senator Pan, please proceed.
Thank you. Good afternoon, and thank you, Mr. Chair and members. I want to thank you so very much, Chair Hernandez, for giving me the opportunity to present this bill first at this hearing. And certainly our bill sponsors are very excited to present this bill, but they also need to get back to the class at school. So we appreciate letting them go first. I would like to begin by accepting the committee amendments, and I want to thank the committee staff for all your work on with my staff and the sponsors to improve this bill. SB 977 is a measure that protects our state's youth and promotes public health by prohibiting the use of tobacco products within 250 feet of an organized youth sporting event. Youth sport events should promote healthy habits for children, but current law doesn't ensure a healthy tobacco-free environment for our young athletes. Secondhand smoke increases the risk of asthma, lung infection, ear disease, among other serious health conditions, and children are more sensitive to these negative health effects. Tobacco use near youth sports events endangers California's children and jeopardizes the ideal of youth sports events as healthy spaces for kids. The state of California has long recognized the dangers of secondhand smoke and led the nation in public health policy when it banned smoking in closed work environments in 1995. California also addressed the public damage caused by secondhand smoke in 2004 with AB 846 by Vargas, which banned smoking within 20 feet of an entrance or operable window of a public building. Allowing the use of tobacco products near youth sports events implies that youth tobacco use is acceptable and consistent with athleticism and good health. However, what we really know is smoking lowers athletic performance and tobacco raises the risk of developing numerous diseases. Tobacco companies often target youth because 90% of adult smokers first began using tobacco products in their teens or earlier, and 2/3 became regular daily smokers before they hit the age of 19. Tobacco use is the #1 cause of preventable death in the United States and around the world. In fact, in California, tobacco-related diseases still claim over 40,000 lives a year, cost taxpayers $18.1 billion annually, or $487 for every resident every year. Tobacco use kills 480,000 people each year in the United States, more than the total number killed by alcohol, motor vehicles, homicide, illegal drugs, and suicide combined. And if the number of smoking-related deaths were cut in half, smoking would still kill more people than all these other causes. It's imperative we protect our youth and set an example by not allowing tobacco products near youth sports. And I'm proud today to have as witnesses the brains behind SB 977, representatives of the St. Elizabeth Ann Seton Schools 8th grade class. Thank you, and witnesses in support.
Thank you very much, Senator Pan. We're going to now move to witnesses support. What I'd like to ask that you do is please state your name, present your testimony, and then we'll move on to the next individual. Welcome, and please proceed. The mic's already on.
Good afternoon, Mr. Chairman and members of the Senate Health Committee. My name is Elizabeth Hinton, and I want to thank you very much for hearing my testimony today. I represent the St. Elizabeth Ann Seton School. The statistics I will list later come from the American Lung Association and the American Heart Association. Our bill began with a simple brainstorm in our social studies class. The class was learning about what it takes for a bill to become a law. As part of the lesson, one of our parents, Mr. Brown, visited our classroom. We were probably the only 8th grade class to have their own lobbyist. As a fun project, we discussed ideas with him about different bills that could become a law. We then narrowed it down to the bill that you hear before you today, because it spoke to us as a class. We were fortunate enough to have Senator Pan sponsor our bill and challenge us as a class to do the work necessary to research and gather the support to bring the bill to where we are today. Most of us are athletes, and we value healthy bodies. Senate Bill 977 is about banning smoking and tobacco usage at all public youth sporting events. In the 1950s and the 1960s, people were not aware of the negative effects that smoking and tobacco usage have on your body. Today is a different story. Now that modern medical science has found out the negative effects, we are all doing our best to prevent smoking and one of smoking's greatest impacts, which is secondhand smoke illnesses. Our bill is important because it will prevent secondhand smoke from reaching the youth and support and strengthen existing anti-smoking and tobacco usage laws. Our newest challenge has to do with vaping and e-cigarettes. We simply do not know the long-term results these products will have on our body, but we do know the chemicals and toxins they release, which are nicotine, aerosol, formaldehyde, lead, and other carcinogens. Now that we know these chemicals can cause cancer-related health issues, it is our job as the future leaders and citizens of the United States to prevent children from breathing in these toxins and to prevent the damage secondhand smoke can do.
Thank you. We'll now proceed to the next presenter. Please state your name and position, please.
Good afternoon, ladies and gentlemen, Mr. Chairman, and members of the Senate Health Committee. My name is George Dadu. Today, I would like to present what Senate Bill 977 means to me. My school, St. Elizabeth, encourages athletics. My parents encourage sports. As a runner, a basketball, and baseball player, I believe all children should have the opportunity to play in a smoke-free environment. We all know the dangers of smoking, and it is our job to take action to make a better future for our children. Smoking has absolutely no benefit. It addicts its victims and slowly kills innocent people. It causes emphysema, cancer, and heart attacks. Secondhand smoke is definitely not something that children should be exposed to unwillingly, especially at an early age. Smoking and sports do not mix, and it is our job to protect our youth and allow them to have a healthy and bright future that is smoke-free. I come from a long line of smokers on both my mother and father's sides. Both my parents have smoked, and most of my aunts and uncles have as well. My grandfather has been smoking since he was 15 years old, and as a result, he has diabetes, high blood pressure, and has a double leg amputee. My grandmother died when I was very young. I remember how she used to take care of me. One day, she was gone. I remember being scared and confused and asking what had happened. Now I understand. My grandmother smoked. Smoking was one of the main contributors to her death. She died of multiple heart attacks at a young age of 59. I miss her. I wish she was still with me today. I wish you could see me sitting here. I wish you could see her smile as she watched me, her grandson, speak at the Capitol on behalf of her and my fellow students as we unite for what we believe in. Senate Bill 977. Thank you.
Thank you. Next presenter, state your name and position, please.
Good afternoon, Chairman, members of the Senate Health Committee. My name is Sean Carambas, and I will tell you statistics about our bill on smoking. My first statistic is that e-cigs are a popular and new tobacco product. People state it only contains water vapor and nicotine, but that is a huge lie. In reality, e-cigs contain toxins such as formaldehyde, tar, ammonia, and other carcinogenic toxins that may cause cancer. This tells us that the e-cig market is really trying to draw in more people to smoke e-cigs just for profit. Secondhand smoke causes lung cancer, gum disease, heart failure, and SIDS, which is sudden infant death syndrome. This shows the secondhand smoke affects absolutely everyone around the smoker, starting from children all the way to pregnant women. When athletes inhale secondhand smoke, their performance during competition is affected drastically. They start to lack blood oxygen and are more vulnerable to experience a stroke. This is important because we want to give our youth a chance to do the sport they want to do without the distraction of a smoker. Kids are most likely to smoke if they see adults and peers smoking as if acting it's okay. Smoking-related illnesses cost more than $300 billion a year. As the number of smokers grow, the higher the cost each year to cure smoking-related illnesses. Currently, 36,000 children who are under the age of 18 have played sports in the past year. Just imagine the amount of people and children affected by secondhand smoke. I would like to cite the CDC, the American Lung Association, and the American Heart Association. Thank you.
Thank you. Anyone else in support of the measure? Is there anyone else in support? Please come up, present your name and position.
Mr. Chair and members, I'm here in my capacity today as the board president of the Cosumnes Community Services District. My name is Michelle Orrock, and we are in strong support of this legislation.
Thank you very much.
Good afternoon, Lindsay Freitas with the American Lung Association in California in strong support. Good job, guys. Callie Hampton, on behalf of the American Heart and American Stroke Association in support.
Thank you.
Autumn Ogden with the American Cancer Society Cancer Action Network, also in strong support. Thank you.
Thank you.
Michelle Gibbons with the County Health Executives Association of California. We represent local health departments, also in support. Good job.
Good afternoon. Russell Nowak on behalf of the California Association of Recreation and Park Districts in support of the bill.
Thank you.
Tim Madden, representing the California chapter of the American College of Emergency Physicians, the California chapter of the American College of Cardiology, all in support.
Kelly Brooks, on behalf of the Association of California Healthcare Districts, here in support.
Teresa Stark with Kaiser Permanente in strong support.
Beth Capel, Health Access in support.
Faisal Saleh, pediatrician from Los Angeles, on behalf of the American Academy of Pediatrics, in strong support.
Colin Robinson, also a pediatrician and internist at UCLA and part of the American Academy of Pediatrics, in strong support.
C. Freeman, Ethnic Minority Organization Section Trustee to the CMA Board of Trustees, standing in support.
Dr. Cameron Escovedo, AAP California, strong support. Good job, guys.
Dr. Robert Newman, Riverside, independent private practice in support of a smoke-free environment.
You know, we're going to pause for just a second. We're going to establish a quorum. We have 5. We're going to establish a quorum. Secretary, call the members.
Hernandez?
Here.
Hernandez here. Nguyen? Hall? Mitchell? Monning? Here. Monning here. Nielsen? Nielsen here. Pan?
Here.
Pan here. Roth? Wolk? Wolk here.
Quorum has been established. Sorry, please proceed.
Thanks so much. Anthony Galassi with the Green Lining Institute, in strong support, and great job, guys.
Dr. Katrina Peters, representative for Golden State Medical Association, in strong support.
Dr. Demi Hember from Children's Hospital Los Angeles, in strong support.
Sarah Peterson, pediatric physical therapist at Children's Hospital Los Angeles, in support.
Rose Castro, president of the California Nursing Student Association, and also former elementary school teacher for the Sacramento City Unified School District, in strong support.
Jessica Curtis, student nurse from Cal State Long Beach, and in strong support.
Colin Cho, a third-year pediatric resident at Children's Hospital Los Angeles, in strong support.
Thank you. We can have the St. Elizabeth Ann Seton School. All those that are here, if you're in support, please stand. Thank you very much. Okay, you can go ahead and have a seat, please. I'd like to call up any opposition. Is there any opposition to the measure? Opposition?
Yeah.
You can come up here, sir. And you guys can stay there. We have room. We can have somebody over here. Please state your name and position.
Wes Parker, and I oppose this bill. Better living through smoking. Cigarettes was originally in 1950. If you looked at the ads, you see cigarette smoking is good for you. That is true. Cigarette smoking is good for your health. All this stuff about being bad for your health and secondhand smoke, that's just to tax it. It's all a bunch of nonsense. Now, I support children being able to smoke on high school campuses because it makes you look cool, it makes you look really tough, and it cuts down on bullying. Thank you.
If we can please refrain from any comment, everyone has the right to their opinion. No, please, we can please refrain from any comment, that we maintain the decorum and the professionalism, that anybody's right and their ability to speak. Okay, seeing no other questions, or no other opposition, is there any questions or comments from any of the members? Yes, Senator Monning.
Thank you, Mr. Chair. I want to thank Senator Pan for bringing this forward on behalf of the students, and to thank the students. I guess a question for any one of the students. How did this idea come to you to begin with?
Well, we were just in our social studies class learning about what it takes for a bill to become a law, and we decided to come up in groups with things that could become a law someday. And we are fortunate enough to have Mr. Brown and Senator Pan help us out, and we decided to see it through.
Great. Well, I applaud you. I'm wondering, have you seen a problem on your playing fields of people smoking near the playing fields?
Every practice I go, I can see people smoking, and just as I said in my speech, I believe that we have a right to play sports in a smoke-free environment, and because sports promote healthiness.
Well, thank you. I applaud your efforts, and thank you, Mr. Chair. And while I appreciate the Chair's comments of respect for all opinions, I will be supporting this bill today, and I believe the science that shows cigarette smoking and secondhand smoke is indeed toxic, and we need to do exactly what you're initiating. Thank you. And at the appropriate time, I'd like to move the bill.
Thank you. We have a motion by Senator Money. Any other questions? Yes, Senator Nielsen.
Mr. Chairman, the question is related to the amendment. Youth sports event means any practice, game, or related activity organized at which athletes up to 18 years are present. I gather it doesn't directly say, it does mean an athletic competition. It means where youth are actually competing. It just says present. That's kind of vague. This means a sporting event, a athletic competition, correct? They're not just watching someone else compete?
Well, I believe that the intent is that at essentially an athletic event, so it could be a competition, it could be a practice, but it's an organized youth athletic event. So it would be an event that's organized for the purpose of youth to be involved in athletics, which would involve either a competition or a practice would count as well. And then
Okay.
But it would be an organized one. A pickup game would not count, as a pickup game. It's actually organized by an entity. So
It would just seem to me that that provision could be more artfully crafted and be more specific, that it is an athletic competition event. I don't have any problem with it. nor do I have any problem with the bill. But it's just a curiosity of the way the verbiage.
Well, perhaps we can take a look at the verbiage and see if there's some clarification to help on that, to make clear our intent if necessary. Thank you.
Thank you. No other comments? So I have a couple, very good bill. Chair will be supporting the bill. I have a couple comments and some questions. Young lady, what was your name again?
Elizabeth Hinton.
Elizabeth, and you had mentioned that you had some help by Mr. Brown. In your opinion, is Mr. Brown a good lobbyist?
He's a really good lobbyist.
And how would you measure that? Because, I'm just curious.
A 10 out of 10.
Okay, perfect. So then we'll take that Mr. Brown is a lobbyist and he's a 10 out of 10. So we'll start tweeting that pretty soon. But I'd like to just take this opportunity for all three of you young individuals to be here. You did an incredible job, and not only your school, but your parents should be very, very proud of not only how you presented yourself, but how you portrayed and gave your testimony. You've done an excellent job, so I want to commend you and congratulations. So with that, we have a motion by Senator Monning. Would you like to close, Senator Pan?
First of all, I want to thank the chair again for your indulgence in letting us present first. I also want to thank all the students for being here and our presenters. I think you did an outstanding job, and respectfully ask for an aye vote. Thank you.
Thank you. We're on item number 2, SB 977 Pan. This is due pass as amended appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Mitchell. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan.
Aye.
Pan, aye. Roth. Wolk. Wolk, aye.
Currently has 5. It's enough to get out. We're going to place that bill on call. Thank you, Senator Pan. We're going to move on to item number 3, SB 997 Laura, healthcare coverage, immigration status. Good afternoon, Senator. So, Senator, if we can just wait just a few minutes to let the room clear. This way, there's a lot of commotion right now, and we'll get started shortly.
My groupies.
Yeah, you might have to. I think
it's my fan club. Can I get a water?
Okay, Senator Laura, we're at item number 3. Please proceed. Welcome.
Thank you, Mr. Chair and members. Let me begin by thanking you and your committee staff for working with my office on this important measure. Members, last year we did an incredible thing. We made sure that every child in California was eligible for Medi-Cal, wherever that child was born or whatever their immigration is. In just over a month, healthcare for all kids will be a reality in California. On May 16th, thousands of California children will enroll in full-scope Medi-Cal. Since we enacted Health for All Kids, we have learned that Kaiser has been voluntarily providing coverage to approximately 70,000 undocumented children for the last 15 years. Kaiser has paid for this coverage as part of their charity care and community benefit program, even though no state or federal law required them to provide such care. Now that Health for All Kids is a reality, the question arises of what happens to the kids that already have Kaiser coverage and are now enrolled in Medi-Cal. How do we assure continuity of care for the families that want to continue to have their children covered by Kaiser while those children transition to comprehensive Medi-Cal coverage? Here's what SB 997 proposes to do. Kaiser will inform the families they serve that they're now eligible for Medi-Cal and should apply. They will also require the family will be given information on how they can remain with Kaiser if they want to. They will also be given information on how to apply for another plan if they would prefer to do that. If they don't select a plan, they will be defaulted into a Kaiser without losing their coverage, and they will have the opportunity to change to another Medi-Cal managed care plan whenever they want to. My intent with SB 997 5997 is to ensure that these undocumented children do not have their care and coverage disrupted as they transition to Medi-Cal coverage. I am also committed to preserving choice in coverage and providers for these particular families. Members, I think we passed out amendments in response to the comments in the analysis and concerns raised by health plans. I am proposing authors' amendments. These amendments do the following: clarify that the bill also applies to children who are currently enrolled in a local coverage plans, requires plans to share information on patients with DHCS so that the department can determine whether the child can continue with their current plan, and also ensures that families are informed of choice, that they can remain with their current plan or select another one. Disruptions in coverage can cause unnecessary confusion, limit access to care, and may even result in the child losing coverage. It is in the best interest of patients and their families to minimize these challenges and make the process as streamlined as possible. That is why I'm working. That is what I'm working to achieve with SB 997. In closing, I'd like to thank Kaiser for being committed to patient care regardless of immigration status. I respectfully ask for your aye vote.
Thank you. Those in support, please state your name and position.
Beth Capel on behalf of Health Access California. We're pleased to be here today as the sponsor of this measure. We were pleased and delighted to discover that in addition to the 120,000 undocumented children who are currently on restricted scope Medi-Cal, who in May will transition to full scope Medi-Cal without any additional activity on their part, that in addition to those children, there were 60 or 70,000 children covered by Kaiser, and we wanted to, our hope for this bill is that those children who are currently covered by Kaiser transition as seamlessly as possible. Because of the way Medi-Cal managed care works in this state, what would happen without this bill is that at some point Kaiser will probably cease paying for coverage for these kids once they are eligible for full scope Medi-Cal. That when a family applies for coverage, the kid would first go into restricted scope fee-for-service Medi-Cal for some time. They would then be in fee-for-service Medi-Cal for as long as 60 days. And then if the family failed to make a choice, the child would be defaulted into a plan that is not Kaiser. In some counties, it is possible for a family that's very diligent to figure out which Medi-Cal managed care plan subcontracts with Kaiser. But in many counties, it is not. I, for example, looked at the Inland Empire Health Plan website and could not figure out how, if I wanted to stay with Kaiser, I could do that if my child was happy. So even if a family tries to make a choice, if they've been defaulted, it'll be hard for them to find their way back to Kaiser. The amendments that we are taking today include some but not all of the county-level programs that provide care or coverage to the undocumented children. Specifically, it includes programs run by the local health plans like LA Cares and Inland Empire Health Plan, but not the programs run by various counties like Healthy San Francisco, and we're committed to continuing to work on that. We did a great thing last year covering all kids regardless of immigration status. We want to make sure that we don't, in the midst of implementing that, disrupt the care and coverage of some of these children.
Thank you. Anyone else, please proceed.
Good afternoon. Ronald Coleman here on behalf of the California Immigrant Policy Center, also here in strong support. Certainly, first off, want to congratulate and thank Senator Lara for his leadership on the Health for All work and also ensuring that Health for All Kids is available in California starting in May. But certainly, now that we have done this job, we don't want any of these kids to fall through the cracks. So like SB 4, where we ensured that folks can transition easily out of restricted scope Medi-Cal into full scope Medi-Cal once beginning in May, we hope that the legislature takes this measure up and supports this as well to ensure that we don't have any kids slipping through the cracks. We definitely want to make sure that people have continuity of care and coverage, and this bill certainly does that, and ask for your aye vote. Thank you.
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty. For as many years as there has been Medi-Cal managed care, Western Center has fought strenuously to make sure people have choice. But when we look at these kids who have been in Kaiser and been in some of these other local health plans, we are concerned about continuity of care. Were they to go from the health plan they're in, then to Medi-Cal fee-for-service, and then back to the plan. So it's very important that the language advise families about choice. The language absolutely does that, and we join others in applauding the senator for this amazing success that on May 16th we'll have hundreds of thousands of additional kids in Medi-Cal. Urge your support. Thank you.
Thank you. Anyone else in support? State your name and position.
Mr. Chair, members of the committee, Brian Allison on behalf of the American Federation of State, County, Municipal Employees in strong support.
Kimberly Chin with the California Pan-Ethnic Health Network in strong support.
Carrie Sanders on behalf of the Having Our Say Coalition, also in strong support.
Michelle Cabrera on behalf of SEIU California in support.
Alejandro Cortez on behalf of MALDEF in support.
Chair and members, Kathy Mossberg representing the local health plans. We want to certainly thank the author, his staff, the sponsors, and the work of your committee staff for taking the language in committee today, and we'll continue to work on this bill as it moves forward. Thank you.
Tim Madden on behalf of the California chapter of the American College of Emergency Physicians in support.
Lupe Aguirre on behalf of the National Immigration Law Center, and we strongly support.
Sarah Flox, California Labor Federation in support.
Good afternoon. Khadija Alam Javed with the Advancement Project. We're pleased to see the element of choice preserved in the bill, and we're in strong support. Thank you.
Enrique Roacha on behalf of the Los Angeles Unified School District in support.
Anthony Galassi with the Green Lining Institute in strong support.
Mr. Chair and members, Teresa Stark with Kaiser Permanente. I'm a bit of a tweener in this situation. We do not have a position on the bill at this time. We certainly want to thank the author and the sponsor for being in close touch with us since they have introduced the bill, and we appreciate and are very thankful for the author's intent. We have been very pleased and proud to take care of these children for many years and hope that they do choose to return to us once they are enrolled in Medi-Cal. We also very much value choice for Medi-Cal enrollees, and we also very much respect the current eligibility and enrollment process for Medi-Cal, but to the extent that we can remove barriers and streamline the process for not only the kids who are in our program, but for all children who are enrolling in Medi-Cal so that they can easily choose the plan and provider that they want to be with, and it's not a difficult process for them. We're certainly in support of that and would like to continue to work with the author. We'll look at the amendments that we got today. They're definitely moving in the right direction in terms of a technical workability perspective, and hope to keep working with all parties. Thank you.
Thank you.
Jessica Curtis, student nurse, California State University, Long Beach, in strong support.
Any opposition?
Jennifer Alley with the California Association of Health Plans. We did receive the amendments this morning, and our membership is currently reviewing them. Officially, right now, CAP is opposed to the bill, not opposed to the policy or the intent, but again, to the process that will be used to enroll these kids, and we will review the amendments that we received this morning, take them into consideration.
The opposition that's going to do the actual testimony, are you going to be part of that or not? Come up here to the dais or the, is there, what's that? Yeah, that's all right. Okay. So we're going to, for opposition like support, we're going to be allowing a total of 6 minutes. So those of you who would like to speak in length, if you can coordinate who your speakers are going to be, it would be appreciated. Other than that, we're just going to be asking for name and position. So is this the organized opposition? Yes. Okay, all right. So we'll go ahead and we'll start here. Please state your name and your position, please.
Dr. Newman, independent practice. Can't hear that. I'm Dr. Newman, independent private practice in the Riverside area for many years. I'm very familiar with the Medi-Cal system and the honorable activity of Kaiser Permanente there, in particular in Fontana. I have reviewed this bill. I find it incredibly confusing as to what it actually is trying to accomplish. I think all of us are concerned about the care of those who are less fortunate than many of us. I think, however, parents need to assume responsibility for the children to the extent that they can. And if more services are provided, the less people step to the plate and assume responsibility. I therefore know personally about Medi-Cal recipients over a long period of time, adults and children, and am very much opposed to this bill. It is also very confusing. Thank you.
Thank you. Opposition.
Jennifer Alley again with California Association of Health Plans. I want to be very clear that we're not opposed to the policy intent of this bill, but more concerned with the process and the choice and how it will be implemented, and that's the nature of our opposition. We did receive the amends this morning. We appreciate the hard work of the author and sponsor and committee staff on them, and we'll take them under review and may have a position change later in the process, but as of today, we're opposed. Thank you.
Chairman and members, Dan Chick with HealthNet. I beg your pardon, I don't have an opposed position. We just received the amendments. I do want to thank your committee staff and the sponsor for the amendments we saw. They do move the bill in a good direction. We still have some outstanding concerns about how the process will work and when will someone receive a healthcare options packet. We also have some concerns and questions about the precedent being established by sort of circumventing that process on the front end. Thank you.
Thank you. Please state your name and position.
Good afternoon. Good afternoon, Chairman and members of the committee. My name is Brenda Diaz with California Coverage and Health Initiatives. We have reviewed the recent amendments to SB 997 and still have some serious concerns. We have shared some suggested amendments to the author, and we look forward to working with him.
Thank you. Anyone else? Please state your name and your position. We can start over here.
Robert Loughton, National Coalition for Immigration Reform Action. What we just witnessed here is a sham. 3 speakers were not actually a part of the opposition. Thank you.
So I did ask ahead of time so you guys can coordinate to come up and speak. So it's not, we're trying to get fair amount on each side. So please state your name and position.
My name is Raul Rodriguez Jr., and I'm with America First Latinos. And because this bill promotes illegal immigration, I am against it.
Thank you.
Thank you.
My name is Mike McGettrick with We the People Rising. The state of California is already in serious debt. I oppose this. We don't have the money to do it.
Thank you.
My name's Robin Vidston with the Remembrance Project. I oppose this bill.
My name is Stella Stevens. I'm with the Concerned Citizens of California, and I strongly oppose this bill.
Thank you.
Wes Parker with Better Health Care for Americans Only, and I oppose this bill.
Deanne Deline of We the People Rising and Fair Tax for California, because it's going to cost a lot of tax for us people. I oppose this bill.
Thank you. Anyone, any other opposition? Questions, comments? Yes, Senator Woke.
Thank you. Senator Lara, I think this has been taken care of with the amendments. I want to be sure. There was a letter from the Community Health Initiative in Napa County about the choice issue. My understanding is that's been taken care of.
That's our goal, is to address the issues of choice. Beth, if you want to.
Okay.
The language, the language that in the bill clearly requires Medi-Cal to give the families notice of choice, and the further amendments further clarify that.
Okay. All right. Thank you very much, Senator Lara.
Senator Monning.
Thank you, Mr. Chair. I want to thank the author for bringing this forward and the supporters who've formed this broad coalition of support. And I think it's important to remember that at the core of this is advancing access to health care. As part of that, access to prevention, health promotion, and building healthier communities. I hadn't been aware of Kaiser's provision of support as part of their charitable work, and want to acknowledge that and thank Kaiser for that contribution to our communities. My question, Senator Lara, is if you have any way to estimate, or if any of the supporters, what would be the cost savings to our healthcare system through expanding this access and healthcare access to children?
We don't have a precise estimate, but certainly having children who are healthier, who can thrive and do well in school, benefits all of us. These are Californians who are here and who are, after all, under the age of 19, and we think it will benefit all of us for them to have comprehensive health benefits as they grow. And perhaps the pediatrician knows the actual answer.
Well, I would think it would also reduce emergency room visits for things like a common cold or a flu.
Broken arm, the simple things, yes.
Senator Monning, there's been several discussions about how much we actually spend a year, and there's an estimate floating around with different think tanks that we in California spend over $1.4 billion annually in emergency room care, and we know that there's tremendous cost savings.
And I would just comment for those who somehow think extending health care to the children of undocumented workforce is un-American. U.S. government is a signatory to the United Nations Declaration on Human Rights. One of the fundamental human rights cited is the absolute right to health care. I think for those who profess different religious commitments to caring for our fellow human beings, they fall short when they think we can exclude certain human beings from that humanitarian outreach. So I thank the author, and at the appropriate time, would like to move this bill.
Yes, Senator Pan.
Thank you, and I want to thank you, Senator Lara, for bringing this bill forward. I was the chair of the Children's Health Initiative in this region. We had 5 counties, and I do want to acknowledge Kaiser Permanente and the Permanente Medical Group, because as we were putting our plan together, they stepped up and helped provided healthcare coverage for children in our region who would not qualify for Medi-Cal or Healthy Families, as we were trying to fill that gap. And I appreciate that what you're trying to do is, because many of them want to continue their coverage with that plan, and with the work that, the landmark work that you did, Senator Lara, and being sure they can actually get coverage through Medi-Cal, we can still continue that continuity of care. And I think that's really important. It is about continuity of care and being able to maintain that. I would also just say briefly is that I think the studies, when we did our Children's Health Initiative, looking at the expenses of actually expanding this coverage to children who did not qualify for Medi-Cal or Healthy Families, is that actually, well, one is that we actually increased the rate of coverage, because when you have families that are basically split, actually what happens, they don't get coverage for either kid. And then the other part is that you have decreased costs from not just ERUs for things that are like a broken arm, but actually what happened is that people who don't have healthcare coverage, it's not that they go walk into the ER and get care. They don't get care until they get really, really sick. And then they show up in the ER, and then they get admitted to the hospital. That's what gets really expensive, because if something we could have avoided a lot earlier progresses and progresses and progresses. And then the other thing is, that's healthcare costs. The other thing is that you have an illness, your child shows up at school, is sick, or just doesn't go to school because they're too sick, they're missing out on their education and their ability to contribute. So in many ways, it's a big win for us as a state to do this. And I was proud to support your previous efforts, and I appreciate your continuing efforts to make this work. Thank you.
Thank you. Seeing other questions, comments, I believe Senator Monning moved the bill. Senator Lara, would you like to close?
Thank you, Mr. Chair and members. Again, this is ensuring that, by enrolling children into Medi-Cal, parents actually are taking an active role in the health care of their children, and this is exactly what we want. We made history last year by ensuring that we covered every child, and this is just a continuum of that progress. And I want to thank the members of this committee in particular for their great vision and helping me in this great endeavor. I've seen and met families up and down the state who are now grateful. There's nothing like talking to a working mother who now can breathe a little easier because she can actually have healthcare for their children. That's something that a lot of us take for granted, and to see that now we're going to be able to provide this really underscores why we're here today. So thank you. I respectfully ask for your aye vote.
Thank you, Senator Lara. We're in item number 3, SB 997, due pass as amended to appropriations. Would you call the members, please?
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Mitchell. Monning. Monning, aye. Nielsen. Nielsen, no. Pan. Aye. Pan, aye. Roth. Wolk. Aye. Wolk, aye.
Currently has 4-1. We're going to place that bill in call. I believe you have a second bill Item number 8, SB 1139, Health Professionals, Medical Residency Programs, Undocumented Immigrants, Scholarships, Loans, and Loan Repayment. Please proceed.